Hello, everyone. Welcome to Lump Basics. We are now on our 41st episode. Let's welcome as our first presenter, Mom Needs You, certified acupuncturist. Good afternoon, Mom Needs.
Good afternoon, Doctor. Good afternoon, everyone. So, the topic for today is medyo exciting kasi one-point therapy for pain. Okay? So, the knowledge of the use of the organ clock gives us the possibility of using the magic of acupuncture to relieve the pain with a wave of a wand. Saglit lang. Let me share with you the great secrets of Chinese acupuncture. It will surely give both you and your patients great pleasure. Okay, tingnan nga natin. Let us draw the organ clock like the Great Wall of China. Okay, from the lungs, large intestine. So follow lang po ng arrow, large intestine, stomach to spleen, to heart, small intestine, to urinary bladder, to kidney, pericardium, triple warmer, gallbladder, and the liver. Okay? We can use one-point therapy when we wish to sedate a meridian quickly in order to produce pain relief. Remember po. So ano nga pala yung mga question? How quickly can we produce pain relief? Oh, it's about 2 minutes or half of 2 minutes. Yes. We always select more distal points to achieve this sedation. The reason for this is that when we use local points, there is an increase in the local blood and energy flow. Although this is beneficial in the long run for healing of the local problem, nagkakaroon ng inflammation of the tissue. It is better to finish with pulling energy away from the pain area, and the dispersion of the congested energy will make the pain and movement easier. Okay? So, to decide where to use this distal point, use this immensely helpful chart. Screenshot po natin. Andiyan na, binigay na yung point. Okay? So, dito sa, sa column, yung sa first column is the symptom, and then the affected meridian, then the treated meridian, and the point. Okay? Sa facial pain, affected meridian is the gallbladder. Treated meridian is the triple warmer or yung pagka-yang angkos. Okay? Point is triple warmer 6. Okay? Headache and neck pain, affected meridian, large intestine and stomach. So, treated meridian is stomach and large intestine. Point, stomach 44 and LI4. Okay? Sa headache, gallbladder is the affected meridian. Treated meridian is liver. Kapag yin ang dahilan. And then the point is liver 2. Okay? Sa shoulder or arm, affected meridian is large intestine. The treated meridian is stomach. And the point is stomach 38. Okay? Pain, affected meridian is triple warmer or small intestine. Untreated meridian can be gallbladder and urinary bladder. And the point use G34 and UB58. Okay? Sa backache or sciatica, affected meridian is urinary bladder. Both yan sa sciatic. And the treated meridian is small intestine, which kapag yang ang dahilan, and kidney if ang dahilan ay yin. Okay? Sa SI7 and kidney 5 ang point na gagamitin. Sa pain in hypochondrium, ang affected meridian is gallbladder. Treated meridian is triple warmer if the cause is yang, and liver if the cause is yin. So points to use, triple warmer 8 and liver 2. Okay? Pain in the legs, affected meridian is stomach. Treated meridian is large intestine. Point to use is LI10. Okay? Hip or knee, affected meridian is gallbladder, can be urinary bladder or spleen or liver. So select na lang po kayo. And the treated meridian, sa gallbladder, triple warmer 5 ang point. Sa urinary bladder, small intestine yung meridian, ISI7 ang point. Sa spleen, lungs po ang gagamitin ng sa treated meridian, lung 6. And the liver, pericardium 6, PC7. Okay? So, sa pain, sa paa or ankle, the affected meridian is the kidney, and the treated meridian is pericardium. So the point you're going to use is pericardium 7. Okay, remember po nyo yan. It will help you a lot. Thank you very much for your attention,
Yeah,
everyone.
thank you very much, Ma'am Nitz. I'm sure many are so excited to make use of this info, no? Especially sa mga wellness missions. Maraming salamat po. Up next is listening and olfaction. This will be presented by Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector. Good afternoon, everyone. Let's now have a new topic, listening and olfaction. Let's talk about first listening. Not only should we listen to what the patient says, but also to how they say it. It is important to listen to the heart and breathing. Take the blood pressure, height and weight, etc. In all the time we spend with the patient, we should be aware of their breathing, coughing, and other sounds like clearing their throat, sniffing, and groaning. We find more about their imbalanced state from these clues rather than from all their verbal complaints. So let's listen first to the speech. Fast and much indicates heart young excess. Loud and aggressive, it indicates liver young excess. Slow, halting, shaky voice, it indicates heart chi deficiency. If the voice is rough or hoarse, it indicates heart yin deficiency. If the voice is soft, then it indicates liver yang or qi deficiency. If it is stammering, it indicates heart yin deficiency, yang excess, or liver yin deficiency. If the speech is slurring, then it indicates heart yang or heart qi deficiency. Now let's go to cough. If the cough is strong and urgent, it indicates lung yang excess. If the cough is dry and urgent, it indicates lung yin deficiency or yang excess. If the cough has with a lot of mucus, it indicates lung dam stagnation. And if the cough is weak and soft, it indicates lung yin deficiency or lung qi deficiency. Next is breathing. If the breathing of the patient is full and noisy, it indicates lung yin excess, as in dam stagnation. Then if the breathing is dry and has a squeaky sounds or obstructive breathing, it indicates yang excess, as in bronchospasm. Next is olfaction. In the Western world, bombarded with perfumes and cosmetic products such as soap gels and body cream, it is very difficult to smell the actual patient. But sometimes, patients complain that their urine is stinking, or that they have had to change their socks or shoes several times in a day because of smelly feet. We can also smell such obviously dominant scents. If the smell is strong, burnt, so it is heat due to yin deficiency or heat due to yang excess, or far heat, especially in the axilla, or concentrated sweat. If the breath is foul, it indicates stomach yang excess, and if there is smelly feet, then it is an indication of kidney yin deficiency. If there is smelly urine, it indicates kidney yin deficiency or kidney yang excess. Okay po? Now, all secretions and emanations tend to get more concentrated and strong smelling if the yin is weak. Secretions become more watery and less smelly when their water content increases. There may be a special smell you would associate with a patient, which could give a clue towards his or her dominant organ system, not necessarily an imbalance or disease. Now, if the smell is burnt, like burnt flesh, so the dominant organ system is the heart. If there is sweat smell like a cooking rice, the dominant organ system is the spleen. If there is rancid smell like rotten fruit, the dominant organ system is the liver. If there is pungent smell like burning spices, the dominant organ system is the lung. And then if there is putrid smell like rotting fish, the dominant organ system is the kidney. Okay po? Thank you so much for your attention.
Thank you very much, Ma'am Teresita. Now let's talk about diagnosis. To be able to diagnose energy status of the patient and his disease, it is important to take a thorough history and also do a detailed examination. Even if the patient has had a recent illness or a musculoskeletal pain, for which intensive energy balancing is not necessary, we need to ask certain questions. After all, we are treating a person with local pain or recent disease caused by an injury or a climatic factor. This person could still have a problem with sleep, with feeling cold all the time, with constipation or nervous diarrhea, and this needs to be treated for the patient to feel a sense of well-being. Remember that we are treating an individual with their own particular history and problems that may or may not be immediately related to the symptom with which they came to us. A good treatment is when we treat the problem and treat the person. Too many therapists treat only isolated regions of the patient's body because they fail to see that this isolated problem is in a unique person's body. We take the problem out of the patient's body, and then the problem does not even exist for real anymore. The author here feels very strongly about this way of treating only the problem the patient comes with for treatment, and therefore he will be presenting to us some cases to substantiate his point. Clinical example, we have a 49-year-old male with shoulder pain. So a man came with pain in the right shoulder, radiating to the arm. He worked on a carousel, although the manual job was not particularly heavy. He had been having pain on and off for more than a year, but this time it had lasted over 2 weeks. He had taken time off work and was on anti-inflammatory medication, which he has been taking at more than the prescribed dose, and had been having stomach pains because of the medication. On observation, he was rather hunched forward in his upper back, though he could straighten himself. Although a tall man, he had been working for many years in a bent posture and seemed to hunch most of the time. His thoracic back seemed to hunch up until the C7 vertebral prominence, and then it seemed to form a rather acute angle with his neck. So this curvature of thoracic spine is very common. Sometimes it is a fixed kyphosis, and sometimes it is just bad posture. In some patients, mostly women, there is also a large edematous lump over the C7 vertebral prominence. You might want to try to palpate that if you have it, okay, which makes the symptoms more constant. So these people keep their head and gaze directed downwards most of the time, only looking up when necessary. When they do look up or when they raise their arm, the acute angle at C6 to 7 worsens, and this will cause pressure on the nerves that supply the shoulder and arm, hence the radiating pain. They have constant pressure on their trapezius muscles. There is also weakening, sometimes even atrophy in the shoulder and deltoid muscles, which means that every time they use their arms, they are straining the neck directly. If we cannot work on the problem of posture, then there would be no permanent solution. to the shoulder pain and weakness of the arms. Why do they hunch? Is it that they have low working areas? Or are they depressed? Or do they have a low tension on the due meridian that runs along the vertebra, the yang of which should keep our back straight? Whatever the reason, you should be able to help patients like the man in the example given. First, we should make them aware of the problem. We could strengthen the yang of the vertebral column with a moxa cigar. We can treat depression with the tonification of the yin and yang of the heart and lung, the two organs in the upper warmer. Use the points, lung 1, bladder 13, ren 14, bladder 15, and pericardium 6. So these are the back shu and front mu points of the heart and lung, and the area distal point of the thorax. In the above patient, the moxa technique of due meridian was used, and local points on the lateral and dorsal sides of the shoulder were used with hot needles. The pain reduced with one treatment and mobility improved. 6 more sessions were given to stabilize the effect, and the patient's wife now gives him moxa on the due meridian once a fortnight. So this is like every 2 weeks to prevent further problems. It is now over 3 years since he had the treatment, and he is still working and has no pain in his shoulder and arm. But he continues to receive moxa treatment because the patient would always go back to the doctor who happens to be the author of our source. No? So we are sure that if only the shoulder pain was treated, he would still have improved for a short period, but then the symptoms would have returned. So after a few courses of treatment, the therapy would have ceased to work. So this is the importance of treating not only the problem, but the patient as a whole. So this is the real holistic treatment. Thank you very much for your attention. Okay, let's talk about diseases and symptoms of the earth element. This is still a continuation of the topic last time, and this time we have, these are all with pain. But if you notice, the pains now are dull. So these are the common characteristics of the pain of the 3 conditions that you can see in front of on your screen. So first we have the increased stomach yin as a result of dull, constant, stone-like, heavy pain. Okay, and there is so this is the pain is worse in the evenings, and it gets worse after meals and after eating cold, raw food, fatty food. So if you remember, this is very yin as contrasted to someone with too much yang. No, okay, so the pain gets worse in the evenings and also after meals, as contrasted to stomach yang excess, in which the pain would disappear after a meal. So there is nausea, prefer warm food. So we have here a cold situation and the warm drinks. So we will have to use bladder 21, stomach 36. Bladder 21 is the back shu of the stomach. And then Ren 12, we have to moxa Ren 12 because of the cold, and the blue connecting point, stomach 40. Then we go to the small intestine. So when you talk about small intestine involvement, there will always be malabsorption. So the prominent symptom here would be malabsorption diarrhea without peristaltic movement, and the symptom is worse in the evenings. There is dull fullness and distension, dull pain, fullness, and distension, and the patient feels better. The pain improves when the patient eats cooked, easy to digest food. So the issue is about absorption. Treatment, bladder 27, stomach 39, Ren 4, and 8 moxa, SI7 luo connecting point. Then we have the large intestine that presented with dull pain. So there is too much yin of the large intestine. There is fullness with downward pressure, distension without passing wind. Semi-solid stools or constipation, which is called the lazy bowel. Points, bladder 25, stomach 37, LI11, LI4 if constipated. Then we have LI6, the luo connecting point. So we do plum blossom hammer paravertebral tapping from thoracic 11 to lumbar 5 until you see a skin red reaction. Stomach 36 is the C point of the stomach. Stomach 37 is the lower C point of the large intestine. Stomach 39 is the lower C point of the small intestine. All meridians have their C points on the elbow or knee, and these points correspond to the main internal organ and are the best points to treat organ diseases. All exterior meridians flow on their organs, and therefore the C point would become also a distal point for the organ on its meridian. However, the exterior meridians of the three young meridians of the arm, which are the large intestine, small intestine, and tripal warmer, they do not run on their respective organs. The C points of these organs are not distal points for the organs. However, the stomach meridian flows on LI and SI, and there are points on the stomach meridian that will influence the function of these two organs. Therefore, these points are considered to be additional C points and are called lower C points of LI and SI, their own C points being LI11 and SI8. Tripal warmer has its lower C point on bladder 39. Thank you very much for your attention. Let's now proceed to the fifth topic for this afternoon. Let's call on Ma'am Lynn Galarita for therapeutic methods. Good afternoon, Ma'am Lynn.
Good afternoon. Good afternoon, Dr. Hector. Good afternoon, everyone. For today, we continue our discussion on the reinforcing method, still on the therapeutic methods. Last time, we discussed about reinforcing on spleen and stomach chi deficiency. So we use reinforcing on or for replenishing chi and blood. So for this, we use the acupuncture points UB20, UB17, stomach 36, and spleen 6. And we could also use moxibustion. Continuing with the points, a quick rundown on the symptoms. For chi deficiency, we have sweating on slight exertion, poor appetite, shortness of breath, spontaneous daytime sweating, food sensitivities, slight sensitivity to cold, fatigue, lethargy, loose stools, dislike to speak, apathy, bloating, weakness at menses, disillusionment, pale complexion, dizziness, muscle weakness, mental fatigue, and the tongue will be pale and maybe with teeth marks, and the pulse will be weak and empty. For blood deficiency, we have floaters in the eyes, dry hair, pale complexion, gets easily startled, scanty menstrual periods, dry skin, a history of heavy periods, mental fatigue, insomnia, muscle cramps, brittle nails, dry eyes, amenorrhea, dizziness, blurred vision, and not being grounded, with a weak, choppy, and thready and thin pulse. Okay. So let's go to the points. Let's start with urinary bladder 20. Next slide po. Next slide na po, Doc. Ay, nawala ang signal.
Nandiyan na po yung slide.
Okay. Urinary bladder 20 is the backshoe point of the spleen. It is a very important point for chronic diseases when person is depleted of energy. So where is UB20? To locate this point, we start with do 6 at the level of the, it is at the level of the lower border of the spinous process of the 11th thoracic vertebra. From do 6, we measure 1.5 tune lateral. That's UB20. We do transverse oblique insertion to this point, 1 to 1.5 tune. Cautioning or oblique needling away from the spine carries a substantial risk of injuring the lungs, thereby causing pneumonia the lungs and the chest walls. Next point is urinary bladder 17, or the backshoe point of the diaphragm. It is an important point for bleeding disorders. To locate this point, from the lower border of the 7th thoracic vertebra, level with do 9, we measure 1.5 tune lateral. So needling this point is an oblique insertion towards the spine, 0.5 to 1 tune. A transverse insertion could also be done 1 to 1.5 tune. Again, like UB20, caution should be observed in needling this point as perpendicular needling or oblique needling away from risk of pneumothorax. Next point is stomach 36. Stomach 36 is the most important point to stimulate action of the stomach and spleen to generate chi and blood. In the previous, yesterday, we have already discussed how to locate this point. It is 3 tune inferior to stomach 36, 1 finger breadth lateral to the anterior crest of the tibia. Or we could go locating GB34 first, and stomach 36 lies 1 tune inferior and 1 finger breadth lateral to the anterior crest of the tibia, and then locate 1 hand breadth below stomach 35. Perpendicular insertion can be done here, 1 to 1.5 tune. This point is usually used to promote general wellness. Okay, next point is spleen 6. Spleen 6 is the intersection point of the 3 yin meridians, namely the spleen, liver, and the kidneys. So it harmonizes and cools blood and promotes and invigorates circulation. Spleen 6 is located pre-tune above the medial malleolus on the posterior border of the tibia on the line drawn from the medial malleolus to spleen 9. Perpendicular or oblique proximal insertion can be done here, 1 to 1.5 tune. Caution should also be observed as this point is contraindicated during pregnancy. So after that, we go to nourishing kidney yin. So for this, we use kidney 3, kidney 6, and UB52 with the reinforcing method. So in kidney yin deficiency, usually there is a slow onset. That means it takes time for kidney yin deficiency to develop. But once you have kidney yin deficiency, a frequent recurrence may be expected. And among the signs and symptoms are aching of lower back, diminished by pressing, as usually a characteristic of deficiency syndromes where pain is usually alleviated by pressure. There's also fatigue, weakness of knee, increased pain after exertion, decreased by bed rest. There is also irritability, insomnia, dry mouth and throat, red cheeks, vexing heat, and five hearts, or what we call the five palm heat, a red tongue with little coating, and a rapid 3D pulse. So to nourish the kidney yin, kidney 3 is the most important point for treating yin deficiency. Kidney 3 is the yuan source point of the kidney meridian. It is located in the depression between the tip of the medial malleolus and the Achilles tendon. Needling this point is a perpendicular insertion 0.3 to 0.5 tune. Next up is kidney 6. Kidney 6, or the shining C point. It is the best point on the kidney channel to nourish kidney yin. It is also the master point of the yin shell vessel and usually coupled with lung 7. It is 1 tune below the prominence of the medial malleolus in the groove formed by 2 ligament bundles. This point lies between the tibialis posterior tendon anteriorly and the flexor digitorum longus tendon posteriorly. These tendons may be highlighted by flexing and inverting the foot. Needling this point is oblique insertion directed superiorly 0.3 to 0.5 tune. Next point is UB52, or the residence of the will. This is usually used for the treatment of depression when person is disoriented and lacks willpower and mental strength to make an effort to get better. This point is located 3 tune lateral to the lower border of the spinous process of the second lumbar vertebra. It is at the level of UB23. Straight insertion is done 1.5 to 2 tune, or we can do transverse insertion pointed towards UB23, 2 to 3 tune for soft tissue injury to low back or nephroptosis. Needling this point, we can expect a sensation of local distension and soreness, sometimes extending to the buttocks. Caution should also be observed in needling this point as to not to insert the needle too deeply to avoid puncturing the kidneys. So in general, reinforcing method should not be used if 1, pathogenic factors are excessive and strong. 2nd, pathogenic factors are not yet completely eliminated. And 3rd, it is a deficiency syndrome associated with excessive and strong pathogenic factors. So that's all for the reinforcing method. Join us next time for our discussion on the reducing method. Thank you for listening.
Thank you very much, Ma'am Lynn. Up next is, we're still on controlling cycle. Let's call on Mom Needs You, certified acupuncturist. Good afternoon, Mom Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. So here, controlling cycle day 4 tayo. Okay. Here is a clinical example. A patient, 22 years old, male. So this is one of the patient of the author. He was a young German, which he saw on 2 different occasions. Once during the winter in Germany and once in a very hot climate of Sri Lanka. He had had asthma since childhood, mainly in winter. It was constant in winter but worse during the night and early mornings and on wet days. Okay? He had cough with white sputum. He was a pale, small-statured young man of few words and he rarely smiled. Okay? The treatment he used in Sri Lanka, he treated the above patient for iron type asthma with young deficiency in the lungs. However, when he saw him later in Germany during the winter, he was no better, hindi gumaling. So he felt that his problem was more to do with the winter climate and that the cold was the reason for his sin state in the lungs. He had excellent results with tonifying his heart yang. His lung yang would not improve as his heart yang was deficient and this made him extremely vulnerable to the cold weather. The small intestine and the triple warmer, the yang organs in the 4 elements should send yang to the lungs in order to control its yin. Okay, so let's go to the drawing. So the fire, as you can see, the yang is deficient, heart, the fire, heart, and small intestine, and the metal, the lung, and the large intestine. Okay, yun. Then, he tonified the heart and the small intestine yang with the following treatment. Bladder 15, the back shoe point of the heart. Bladder 13, back shoe point of the lung with hot needles. Okay. So, SI3, tonification point of the small intestine. Triple warmer 3, tonification point of the triple warmer. Lung 10, power point of the lungs. LI11, tonification point of the large intestine. REN 17, he used moxa, which is the influential point for the respiratory organs. And he used PC6 and REN 22 symptomatic symptoms. Thank you very much for your attention, everyone.
Thank you very much, Mom Needs. Let's now proceed to topic number 7. Let's call on Mom Lynn once again for meridian theory.
Good afternoon ulit.
Good
We're
afternoon.
on the 4th part of our topic on the triple burner of the Shaoyang channel. So for today, we'll discuss physiological significance of channel changes. In general, because the Shaoyang channel has an abundance of qi, but a dearth or a scarcity of blood, it tends to generate heat. When observing the channel, especially on the neck and shoulders around triple burner 15 to triple burner 17, one should look for redness, small papules or acne, which indicates an accumulation of heat in the channel. In pulse palpation of areas related to this channel, there are no special consideration for palpating the pulse along this channel. So let's start doing palpation, pressing the points and feeling the body surface. In many patients, there may be a generalized bumpiness all along the triple burner channel on the forearm. The channel will feel somewhat like one is bouncing along an unpaved road. This sensation is indicative of generalized heat accumulation on the triple burner or the ministerial fire. Clinically, it often coincides with conditions of chronic systemic inflammation or systemic inflammation and or some type of autoimmune conditions. The pathways of the triple burner have been blocked by stagnation of qi and or accumulation of phlegm. Alternatively, Very soft nodules all along the forearm may indicate a deficiency of source qi and an accumulation of cold in the triple burner pathways. Tenderness in the area around triple burner 2 and triple burner 3 indicates qi stagnation leading to compromised dispersion of warmth from the Shaoyang. Although many types of qi stagnation may produce changes in this area, the changes most often appear when there is back pain, especially pain due to cold accumulation in the muscles of the low back. This is due to compromised circulation of source qi affecting the gate of vitality area on the back. The area may also be tender in the presence of heat in the Shaoyang channel affecting the ears. Symptoms may include earache, excessive wax, or a sensation that the ears are clogged. There will often be a deep aching sensation with pressure at triple burner 4 in the presence of yang qi deficiency. This often involves deficiency of yang qi in the extremities, typically with symptoms of coldness and or numbness. Moxa or needles may be used in treatment. Here is a diagram locating Sanjiao 4 or triple burner 4. So that's all for now. Let's continue our discussion on the triple warmer meridian tomorrow. Thank you for listening.
Thank you very much, Mom Lynn. So try palpating your triple warmer 2, 3, and 4. So that we will be able to determine if you've been accumulating a lot of cold there. Okay, so let's now proceed to the last topic for today. We are still on Western differentiation of chest painful obstruction syndrome. Now let's talk about aortic dissection. An aortic dissection is another serious and potentially fatal condition in which the inner layer of the aorta tears. As blood surges through the tear, it causes the inner and middle layers of the aorta to separate. The most common risk factors are long-term hypertension or genetic predisposition, as in Marfan syndrome. Pain is described as a tearing, ripping, or shearing sensation, often behind the sternum and radiating down the back into the interscapular region. It may be migratory and follow the path of the propagation of the dissection. Pneumonia and pleurisy. In the lung, the sensory receptors called nociceptors are located only in the pleura. Therefore, any pulmonary pain can be attributed to pleural involvement. Pleuritic pain presents with well-defined characteristics. It is worse below the nipple and is definitely worse on inhalation and coughing. It is often associated with fever. The diagnosis of pleurisy can be confirmed with the help of a stethoscope. When this is placed over the chest, both front and back should be checked. A typical friction rub can be heard at the end of exhalation or inhalation. This is due to the rubbing together of the two pleural surfaces. This friction rub can be differentiated from other lung sounds as it does not disappear after coughing. It is therefore advisable when an adventitious sound is heard to ask the patient to cough. The pleural rub will not disappear, while the sounds generated by mucus in the bronchi will. Pneumothorax refers to the presence of air in the pleural cavity. It can be either spontaneous, when an air bubble in the lung tissue ruptures and the air makes its way out of the lung, or caused by trauma. Symptoms include sudden chest pain similar to pleuritic pain associated with dyspnea. Lung carcinoma. This is more common in men over 40. It may manifest with a cough, a deep-seated chest pain, hemoptysis, loss of appetite, and loss of weight. It causes pain only when nerves, blood vessels, bones, or the pleura are involved, as these are the only structures with nerve endings that transmit pain signals. Thank you very much for your attention. We hope that you can join us again tomorrow for the next presentation. Thank you so much.